Hello and welcome to this session. This is Learning Outcome 1 with the title Understand the Nature and Types of Diabetes. How does diabetes affect millions in the UK? This video explores the nature, types, and impact of diabetes on individuals and society. Discover the key aspects of managing this chronic condition. Diabetes mellitus is a long-term metabolic disorder affecting blood glucose regulation. It occurs when the pancreas fails to produce enough insulin or the body doesn't use it effectively. Insulin helps move glucose into cells for energy. Without it, glucose accumulates in the blood, leading to complications. Diabetes is chronic but manageable with lifestyle changes and medication. Type 1 diabetes is an autoimmune condition where the immune system attacks insulin-producing cells. It often begins in childhood or young adulthood. The body produces little to no insulin, requiring lifelong insulin therapy. Symptoms develop quickly and can be severe. It accounts for about 5 to 10% of all diabetes cases. Type 2 diabetes is the most common form, linked to insulin resistance. It often develops in adults over 40 but is increasingly seen in younger people. Obesity, poor diet, and inactivity are major risk factors. Management includes lifestyle changes and sometimes medication. It makes up about 90 to 95% of diabetes cases. Gestational diabetes develops during pregnancy when insulin production is insufficient. It usually resolves after birth but increases the risk of type 2 diabetes later. Hormonal changes during pregnancy make the body more insulin resistant. Management includes diet, exercise, and sometimes insulin. It poses health risks for both mother and child. There are less common forms of diabetes such as MODY and LADA. MODY is a genetic form diagnosed before age 25. LADA resembles type 1 but develops slowly in adults. Secondary diabetes results from other medical conditions or medications. These types require specific management approaches. Type 1 diabetes is caused by an autoimmune reaction, while type 2 results from insulin resistance. Type 1 requires insulin from the start, whereas type 2 may not initially. Symptoms of type 1 appear suddenly, while type 2 develops slowly. Both types require different management strategies. Type 2 is more prevalent worldwide. Gestational diabetes develops when pregnancy hormones increase insulin resistance. The placenta produces hormones essential for the baby but challenge insulin function. Normally, the pancreas compensates by producing extra insulin. If insufficient, blood glucose levels rise. This condition requires careful management during pregnancy. Certain factors increase the risk of gestational diabetes. Being overweight before pregnancy and a family history of type 2 diabetes are major risks. Previous gestational diabetes or a very large baby heighten the risk. Some ethnic backgrounds are more susceptible. Being over 25 years old also increases the likelihood. Gestational diabetes poses risks for both mother and baby. Mothers may face high blood pressure and need a C-section. Babies can be larger than normal or born prematurely. There's a risk of low blood sugar after birth. Both mother and child have a higher risk of future diabetes. Managing gestational diabetes requires a healthy diet and regular exercise. Monitoring blood glucose levels is crucial. Medication or insulin may be necessary if lifestyle changes aren't enough. It's important to follow medical advice closely. Proper management ensures better outcomes for both mother and baby. Over 5.8 million people in the UK live with diagnosed diabetes. An estimated 1.3 million have undiagnosed type 2 diabetes. Total cases likely exceed 7 million. About 90% have type 2, 8% have type 1, and the rest have rarer forms. The prevalence continues to rise. Diabetes significantly contributes to cardiovascular disease and other complications. The mortality rate for diabetes-related deaths was over 62,000 in 2023. Diabetes patients often miss recommended care checks. Few achieve all treatment targets, increasing complication risks. The impact on health is profound and widespread. Diabetes care imposes a heavy economic burden on the NHS. Costs include medications, monitoring, and complication treatments. Specialist care for complications adds to the strain. Rising prevalence and undiagnosed cases suggest future cost increases. Effective management is crucial to control economic impact. Diabetes affects quality of life with frequent monitoring and dietary restrictions. Certain ethnic groups face higher risks and earlier onset. Diabetes is linked to other health conditions, compounding risks. Many type 2 cases could be prevented with lifestyle changes. Early identification and intervention are key. Diabetes can result from autoimmune reactions or insulin resistance. Type 1 is autoimmune, destroying insulin-producing cells. Type 2 involves insulin resistance, often linked to lifestyle factors. Understanding these mechanisms helps tailor management strategies. Both types require different approaches for effective control. Pregnancy introduces unique insulin challenges. Hormones produced during pregnancy increase insulin resistance. The pancreas must produce more insulin to compensate. In some cases, it cannot keep up, leading to gestational diabetes. Managing these challenges is crucial for maternal and fetal health. The NHS faces a significant burden from diabetes care. Increasing cases strain resources and services. Specialist care for complications adds to this burden. Effective management and early intervention are vital. Addressing diabetes requires coordinated efforts across healthcare systems. Diabetes trends indicate rising prevalence and health implications. Increasing cases suggest growing healthcare demands. Long-term management is crucial to mitigate complications. Addressing lifestyle factors can reduce type 2 diabetes risk. Proactive healthcare strategies are necessary for future challenges. Prevention and early intervention are key to managing diabetes. Identifying high-risk individuals allows for timely action. Lifestyle changes can prevent or delay type 2 diabetes. Education and support are essential for effective prevention. A proactive approach benefits individuals and healthcare systems. Professional support is crucial in diabetes management. Healthcare providers offer guidance on lifestyle changes and treatments. Regular monitoring and checkups prevent complications. Support networks help individuals manage daily challenges. Comprehensive care improves outcomes and quality of life. In conclusion, we have learned that diabetes requires understanding and proactive management. From lifestyle changes to professional support, each aspect plays an important role. With the right strategies, individuals can effectively manage diabetes and enhance their quality of life. In closing, thank you for watching this video. If you have any questions, please send us a message on WhatsApp at 07484361688. Thank you for your attention and goodbye.